Hello, Vernon. My name is Patrick. I'm a student physical therapist. I'll be working with you today. How are you doing?
Doing good.
Nice. So the purpose of today's session is to assess the sounds of your lungs and the function. And then if I identify any impairments in any part, I'll provide an intervention and then demonstrate that, and we'll practice that to try and reduce or resolve some of your symptoms. Let me know if you have any questions or concerns throughout today, and let me know. We'll be taking some deep breaths throughout, and let me know if you become lightheaded at any time, and we can take some breaks, okay?
Okay.
We're also going to be, towards the end of the intervention, trying to recreate a cough, so if at any point you do need to cough, got some tissues beside you, feel free to use those, okay? Any questions before we get going?
Nope.
Nice. So first, we're going to assess the front side. I'll be using a stethoscope to kind of listen to the sounds of your lungs. I'll be moving around different places, trying to compare side to side to get an idea of how you're doing, okay? All right. And there'll just be a little bit of pressure on each side of your chest, okay? I don't want you taking too crazy of a deep breath, just a nice. Breathe in. Good job. Okay. Now, let me just hear that side one more time. Nice. Now, if you wouldn't mind, turn around for me. Yes. All right, it's the same thing, just on the back side, okay? Sorry. All right. Good job. Good. All right, one more area. All right, nice. Let's go ahead and turn around for me. So during my assessment overall, I didn't hear anything too crazy. I just heard a little bit of crackling in your right lower lobe. That could be indicative of some phlegm hanging out at the bottom of your lungs, which is not uncommon. I'm gonna provide you an active breathing cycle intervention to help reduce some of those symptoms and see if we can resolve, and then we'll reassess afterwards to see how you're doing, okay?
Okay.
So first, you want to make sure we're sitting up well, nice relaxed shoulders. You're going to place your hand on your belly. We're just going to take a normal breath, but make sure we're getting a nice deep breath. So you're going to breathe in through your nose. So make sure we're in through your nose, belly. You're kind of coming up through the chest too much. There you go. There you go, that's good. So that's the first component. There's gonna be 3 components. The second one, you're gonna place your hands on your ribs. And this one's, I wanna try and expand your ribs when you take the deep breath. So. And this is just trying to further expand your ribs and trying to get some of that phlegm working its way up, okay? All right, and the next one, so you go relax. So we'll do that 3 to 5 times as well. And then the next one, you're gonna take a nice deep breath. And then you're gonna, like you're breathing, like you're trying to clean your glasses, so to speak. And then following that, I want you to try and cough, okay? So you got a tissue over there to take care of that. So once again, 3 to 5 nice deep belly breaths. If you have any questions before we get going, then we'll go ahead and give you a shot. All right, so go for it. Good job keeping your shoulders nice and relaxed. A couple more through your belly. All right, now place your hands on your ribs. There you go, good expansion. Do that 3 more times for me. There we go, see some working up already. Feeling okay?
Yeah.
All right, 1 more of those for me. All right, I'll take a, yeah, there we go. Take a deep breath. Try it. All right, no, there you go. Nice. So looks like that worked pretty good. Are you feeling lightheaded or anything?
Nope.
Do you need any water or anything?
Mm-hmm.
Okay. Just to see how that worked in the right lower lobe, we're going to go ahead and reassess some of the sound in that area. You got any questions before I do that?
Oh.
Nice. So just take a nice deep breaths. Good job. Nice. So I noticed no crackling in your right lobe, so that's good. It sounds like the active breathing cycle worked. If you notice that you're having any congestion, you can try and practice this technique at home by yourself. Just it would be good to look in a mirror just to make sure you're not shrugging your shoulders and having a nice relaxed breath and proper hand placement throughout. If you want to do that, you can go through 1 cycle. If you notice if you're still having some symptoms, you can go ahead and repeat the cycle. Once you get that productive cough, it's a good sign that the mucus and phlegm kind of working its way out. Any other questions, concerns with that?
No.
All right, well, I'm glad that worked out for you today, and feel free to use that moving forward, okay?
Thank you.
You're welcome. Good job.